social security system in Vietnam and Vietnam's social security as a system encompasses policies and programs aimed at ensuring a minimum standard of living and providing support in cases of occupational risks, illness, unemployment, old age, and special hardship. The system is structured around 5 main pillars. Pillar Target Group. Main content. 1. Social insurance, SI employees with labor contracts. Pension. Minimum of 45% of average wage based on SI contributions. Survivorship. Allowance equivalent to 1 to 2 months' salary for family members. Occupational accidents and diseases. 100% wage compensation and treatment costs. 2. Health insurance. High universal mandatory and voluntary participation. Covers 80 to 100% of medical examination and treatment costs within the benefit package. Support across commune, district, provincial and central level health facilities. 3. Unemployment insurance UI mandatory SI participants. Unemployment benefits equal to 60% of average wage contributions. Up to 12 months. Support for vocational training, job search, and startup counseling. 4. Social assistance, vulnerable groups, the poor, persons with disabilities, orphans, elderly without pensions. Regular allowances, 360,000 to 540,000 VND per month. Emergency relief, scholarships, housing support. 5. Social welfare services, general population, organizations, communities, social protection facilities, elderly care homes, orphanages, charity centers, disaster relief services. 1. Social insurance, SI target group, workers with contracts of at least 1 month. Contribution rate, employees 8%, employers 17.5% of basic salary. Goal, cover 50% of the labor force by 2025. Expand voluntary SI for informal workers. 2. Health insurance high target group, mandatory high, civil servants, public employees, formal workers, voluntary high, households, self-employed. Contribution rate, 4.5% of salary, employee 1.5%, employer 3%. Students, 4.5% of tuition fees. Coverage, over 95% of the population. 3. Unemployment insurance UI target group, mandatory SI participants. Contribution rate, employees 1%, employers 1%. Eligibility at least 12 months of SI contributions. Application within 3 months after job loss. Duration, 3 to 12 months, depending on contribution period. 4. Social assistance, regular policies, allowances for the elderly without pensions, allowances for orphans and persons with severe disabilities, emergency policies, support in cases of natural disasters and epidemics, assistance for families in difficulty. Poverty reduction program, target to reduce poverty rate to below 3% by 2025.5. Social welfare services, social protection facilities, orphanages, nursing homes, rehabilitation centers, community support, job placement centers, legal advice, psychological counseling. Non-governmental organizations, NGOs, provide services and mobilize funding. Development directions, expand coverage of SI and high to informal workers and vulnerable groups, increase benefit levels and adjust for inflation and living costs. Strengthen primary health care and improve referral linkages to reduce overload at central hospitals. Develop a digital social security system, population database, integrated CHI and social assistance management. Enhance international cooperation in technology transfer and workforce training in social security.